Welcome to Medication Assisted Treatment presented by the Grove Recovery Center. The use of medication with counseling and behavioral therapies to treat substance use disorder and prevent opioid overdose is referred to as medication assisted treatment, or MAT. It provides team-based care for people with substance use disorder through structured, integrated services. MAT brings a whole patient approach to treatment, and research has shown it to be effective. What does MAT do? MAT improves client survival, increases retention in treatment, decreases illicit opioid use and other criminal activity among people with substance use disorder, increases patients' ability to gain and maintain employment, and it improves birth outcomes among women who have substance use disorders and are pregnant. The FDA has approved methadone, buprenorphine, and naltrexone as drugs that can be used for medication-assisted treatment in treating opioid use disorder. Currently, the agency only uses buprenorphine and naltrexone for medication-assisted treatment. We do not prescribe methadone. Some of the benefits of MAT are: it reduces or eliminates withdrawal symptoms, reduces or eliminates cravings, blocks the feel-good effects of opioids and alcohol, and stabilizes brain chemistry that drives motivation and bonding with others. What is the goal of MAT? The ultimate goal is full recovery and the ability to live a self-directed life. Other goals include improving patient survival, increasing retention in treatment, decreasing illicit opiate use and other criminal activity among people with substance use disorders, increasing patients' ability to gain and maintain employment, and improving birth outcomes amongst women who have substance use disorders and are pregnant. Common myths associated with medication-assisted treatment. MAT is just trading one drug for another. People that use MAT are under the influence. People that use MAT are not really clean and sober if they take medications. I urge you at this time to identify myths that you likely have heard along the way as it relates to medication-assisted treatment. In doing so, I also urge you to take a look at your own personal biases as it relates to MAT and seek guidance from your supervisor. How buprenorphine works. It diminishes the effects of physical dependency to opioids such as withdrawal symptoms and cravings, increases safety in cases of overdose, and lowers the potential for misuse. Treatment with buprenorphine for opioid use disorder. To begin treatment, an opioid use disorder client must abstain from using opioids for at least 12 to 24 hours and be in the early stages of opioid withdrawal. Clients with opioids in their bloodstream or who are not in the early stages of withdrawal may experience acute withdrawal. After a client has discontinued or greatly reduced their opioid use, no longer has cravings, and is experiencing few, if any, side effects, if needed, the dose of buprenorphine may be adjusted. Due to the long-acting agent of buprenorphine, once clients are stabilized, it may be possible to switch from everyday to alternate day dosing. Common side effects of buprenorphine: constipation, headache, nausea and vomiting, dizziness, drowsiness and fatigue, sweating, dry mouth, tooth decay, muscle aches and cramps, inability to sleep, fever, blurred vision or dilated pupils, tremors, palpitations, or disturbance in attention. Serious side effects of buprenorphine include respiratory distress, overdose, adrenal insufficiency, dependence, withdrawal, itching, pain, swelling, and nerve damage, pain at injection site for injections, neonatal abstinence syndrome in newborns. The following are buprenorphine products approved by the FDA. Please take a moment to review the list. This is the Grove's policy as it relates to clients and MAT. Clients have the right to request MAT at any time. You must notify medical if a client expresses interest in MAT so they can take the steps to have the client meet with a provider. Clients must have a history of opioid use to be considered. Please see Policy 1318 for more information regarding the agency's buprenorphine policies and procedures. MAT treatment will only be offered inpatient at this time by the Grove Recovery Center, that is, at the residential level of care. Only a 10-day supply of Suboxone will be ordered initially to prevent AMA. Sublocade will be offered to each client during treatment, and they'll be educated on the benefits by providers. If a client leaves against medical advice while in the MAT program, there will be consequences when returning that will include the client will only be offered Sublocade. First dose of Sublocade is ordered while inpatient and administered before discharge. The second dose may be required if a client is already admitted on Sublocade. If you become aware of a client cheating or sharing meds, you must notify nursing staff immediately. Referrals will be provided while inpatient treatment is being completed to any client that is currently engaged in our MAT program at the Grove Recovery Center. Appointments will be provided and documented by the discharge planner. Clients requesting MAT while at the IOP level of care will be referred to an outpatient provider that offers MAT. Currently, the Grove is only offering MAT treatment for those in residential care. This concludes the MAT training presented by the Grove Recovery Center. Please proceed to completing the post-test. Thank you.